Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is a conversation with local health experts to help you focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering any questions that you have live in the studio today. We'll be opening those phone lines in just a couple of minutes. You'll see it on the bottom of your screen. But when you do call, make sure you're in a quiet room so that we can hear your question. And if you're listening to your TV, we ask that you turn your TV all the way down so that we can clearly hear you. That number is 318-219-4569. Again, it will be right there on your screen. Joining us today is Dr. Jagan Beedupalli, interventional cardiologist with Willis-Knighton Cardiology. Thanks for joining us.
All right, thank you. Thank you for having me, Courtney.
Absolutely. So you are right here in Shreveport with Willis-Knighton Cardiology. And tell us first, what does being an interventional cardiologist mean? So
interventional cardiologist means we take care of heart conditions through minimally invasive procedures like, doing putting catheters into your heart arteries, putting stents to if you have any blocked arteries, and then we even deal with blockages in the other arteries like the ones going to your brain or the ones going down your legs. Mm-hmm. So we deal with all those blockages, putting stents, opening them up, and if somebody has a heart attack, we try to get that clot out of the heart artery and then re-establish flow so that we prevent that heart attack and restore the heart muscle back to its normal function. And we also deal with things like putting new valves in the heart also through catheters, so it's all through minimally invasive procedures. Instead of going through an open heart surgery, we deal with all these heart conditions through just catheters where the recovery time is very little and they go home basically the very next day.
Nice, yeah. For me, the layperson, it kind of sounds like you're like a mechanic for the heart.
Yeah, more like a plumber.
A plumber, okay,
exactly.
I like it.
So you're dealing with plumbing issues, just opening up all the blockages and taking care of stuff through, instead of breaking the whole house down, you just go through those pipes and then just try to take care of stuff.
Nice. Yeah, it sounds very complicated. And do you have to have specialized training for this?
Yeah, absolutely. So we go, after medical school, we go through residency, 3 years of internal medicine where we just deal with, learn about everything in the whole body. And after that, we specialized in cardiology for 3 more years. And then after that, depending on what you're planning to do, 1 or 2 years of interventional cardiology. So basically after your med school, it's like maybe another 6 to 7 years of extra training that we go through.
Nice,
to get here.
Yeah, and there's probably been so many advancements just in the last couple of years.
Absolutely. So once I've been done with my fellowship for about 23 years right now, 23, 24 years. And in this last, I graduated in 2012. So since then until now, there are a lot of advances. Nice. So we had to keep up with all the new advances, and then you just keep doing all the latest cutting edge things to keep our patients accessible to all the new advances in healthcare.
For sure. So by the time that a patient sees you, they probably already have heart disease or some kind of blockage, right?
Yeah, most of the time, but sometimes we see early on, when they have a lot of risk factors, they come in just to make sure everything is well taken care of. So rarely we see like a few patients where they don't have any heart disease yet, but they're at risk of having heart disease down the lane. So those are the ones, I really encourage those kind of visits to the doctors where, if you're aware that you have a high risk, say have a strong family history of heart disease, you might want to come early to a doctor, especially the heart doctor, just to make sure all your risk is under control. If there is any screening techniques that you need to go through them and understand your risk and see what you need to do to keep that risk under control.
Right.
We do see all sorts of patients.
Nice, yes. And today specifically we were talking about that risk for heart disease, especially in young adults, and you've probably seen that increase in prevalence.
Yeah, absolutely. So even if you look at the literature in the last decade, there have been a significant increase in heart disease in younger patients. And when I say younger patients, more like in their early 30s, until their late 40s, it was more like maybe 1 in 10 people had heart attacks in that age group, but lately we're seeing more like 1 in 5, almost double the risk in the last decade. And of course, there are other heart conditions that you see in young people, like thickening of the heart muscle is called hypertrophic cardiomyopathy, and then things like bad heart rhythm problems that can cause cardiac arrest. They've been there, those are all genetic, but what we're seeing an increased trend is the heart attacks because of increased risk of all these blockages. And you hear about young people just dropping down on the track or in the sports fields, just because of all these increased risk factors. And then
wow, yeah, really scary stuff. And
yes,
do you think it's
absolutely.
because of family history or is it lifestyle?
Well, definitely family history plays a big role in, say, like somebody having a heart attack early on in their life before 40 years age. But definitely lifestyle has a pretty big influence in there, because even if you have like a strong family history, you can curb it by maintaining good lifestyle, eating healthy, exercising regularly, and minimizing your screen time and staying outdoors and doing stuff.
Right.
But lately things have been going in the wrong direction where you don't get enough exercise outside and you're just more processed food, because food industry is more like it became an industry. It's not the regular food that you get, it's just people making money out of the food. So more processed food, and which is unhealthy, that's contributing to raising heart disease risk, and also lack of exercise, more screen time with increase in social media, people hooked on to their cell phones all the time rather than just staying in the real world, which is around them, and staying active. So all these things contribute to increased risk, and of course family history definitely plays a big role.
For sure, yeah. So family history, are there any specific genes that you know of that are linked to heart disease?
The genes, especially for heart disease, we don't know the exact genes what causes these early blockages, but definitely there are some genes which can cause high cholesterol. It's called familial hypercholesterolemia. So people tend to have like really, really high cholesterol early on in their life, and then once that happens, you start forming blockages in your heart arteries and everywhere, and then that's when you end up having a heart attack early on. And some people just have a tendency to have a heart attack early because their blood vessels are kind of very frail. There are a lot of connective tissue disorders where the blood vessels are made of all these connective tissues. So they're very frail, and that can cause some dissections we call damage to the blood vessels, and then that can contribute to heart attacks. So yeah, there are some specific genes involved in all of that, but there's a lot of genes that we don't know.
Right.
That raises the risk of heart disease. And of course there are other genes that cause what you call a hypertrophic cardiomyopathy, which is more like it causes thickening of the heart muscle. And once you have a thickened heart muscle, when it goes beyond a certain point, you are at risk of cardiac arrest. Especially you see these in people like young athletes who are very healthy, and then they just suddenly drop dead and they had a cardiac arrest on the field. And we know a lot of people who had that kind of situation. That runs in families also, and there are a lot of other heart rhythm problems that can cause cardiac arrest.
And those specifically, separate from the heart attacks, from lifestyle, the hardening of the heart is kind of something that it's hard to prevent, would you say? Or
well, it's not really hard to prevent. In fact, it is easy to prevent. But the process of doing that is hard. Meaning, if you do the right thing, you can prevent it. But doing it is hard. It needs commitment, and then, of course, if you think anything is hard, it's hard. If you think I can do it, you can do it.
Absolutely.
Just strict lifestyle changes and have time to exercise regularly.
Even for those that are athletes that are already active?
The athletes who are already active, that's pretty good that they're active, but they need to listen to the body. So sometimes you have things called anomalous coronary arteries, where the arteries come from different locations. Sometimes that can cause heart attacks. That's very rare, but can happen. So things to look for is if you start having chest pain when you are exerting, or if you get really short of breath or feel faint or pass out with exertion, that's a sign that there's something going on and you need to get yourself checked before you continue that vigorous activity. Sometimes you can have things called myocarditis, where it's just like an infection, just like have a flu. That can affect the heart also and can cause a situation called myocarditis, which is like basically inflammation of your heart muscle. And if you continue to be active when you have it, that's a risk of cardiac arrest also. That happens in young individuals especially, because they are the ones who are really active and they feel like my heart is great and they keep going.
Right.
So you got to listen to your body. So if you have any symptoms, so just instead of just ignoring it, you just need to figure out what exactly is going on, why I'm getting the shortness of breath, why I'm fainting or feeling faint when I'm exercising, and that kind of, just listen to your body. But if
Right.
your body is good, just keep going.
And for the more chronic heart disease that happens over time, like with the cholesterol that builds up, and the high LDL, the low HDL, those are sometimes things that you don't really have symptoms of until maybe it's much
Absolutely,
later.
yes.
So how important is it to keep up to date
right.
on that?
These are called silent killers. That's why they are silent, because you don't even feel it. The same thing with blood pressure. We see young patients whose blood pressure is like 230 or 120, and they feel like I'm feeling good. I don't have any symptoms. But if you leave it like that, that's why they call it silent killers. If you leave it like that, over time, it can cause heart attacks, it can cause strokes, it can cause kidney failure, ending up on dialysis. The same thing with high cholesterol. You won't feel bad or anything. It's there slowly doing its job, building up plaques in your heart arteries or anywhere. And then at one point you'll have a heart attack, and that's the time you'll know that you had high cholesterol. So healthcare, access to healthcare is very important. So once you hit close to 40, you need to go to a primary care doctor and get your cholesterol levels checked, and check your blood pressure. I would encourage, even in the mid-30s, you may start doing that, because it's never too late to start a healthy lifestyle. So that was the thing I said in our preview, that the risk modification starts very early, even in fact in childhood. The kind of lifestyle changes that you incorporate will stay with you rest of your life. If you're active, you're used to being active, you want to be active rest of your life. And if you are used to eating healthy, you will eat healthy rest of your life. So the habits that form in the childhood are very, very important, that stick with you rest of your life. So if you form a good lifestyle, healthy habits in your early on, that'll stick with the rest of your life, and it will reduce all these risks.
For sure, yeah. And let's say someone, just kind of hypothetical, let's say someone has a parent and they're male, because it's probably more common in males, as you've seen maybe in the literature that heart disease is more common in males, or would you say it's pretty even?
Yeah, until menopause, women are kind of protected, because the female hormones are protective against heart attacks and stuff like that.
Okay.
So until menopause, women definitely are at a very low risk compared to men. But after menopause, it catches up significantly, and they kind of catches up with men, and sometimes even it exceeds men over time. Yes, absolutely.
Good to know.
Absolutely, yes.
Yeah.
And even in young women, sometimes especially around pregnancy, during labor and delivery, when you have, because at that time, because of the female hormones, cause some frailty to the blood vessels, and we see sometimes heart attack in young mothers right after delivery, because of what you call a spontaneous coronary artery dissections, where the artery dissects and the blood clot forms there and causes heart attack. It's very, very rare.
Okay, good.
But
yeah.
it's very rare. Of course, the nature. Human race won't be this far if it's common.
Right,
Because,
right.
Yeah, women's health, especially a mother's health, is extremely important. So it's extremely rare, but things like that do happen. So, but yeah, usually overall, women are protective against heart attacks and stuff until they hit menopause.
Gotcha. Okay. So are the symptoms similar that they across the board? Things that you want to look out for.
Yeah, women most of the time they tend to have very atypical symptoms. More like the classic heart attack symptoms include like tightness in the chest, shortness of breath, or tightness radiated into the jaw, left arm, and stuff. But that's not very, very common in women. They can present with symptoms like just shortness of breath, sometimes indigestion, sometimes just kind of feeling faint, or very vague atypical symptoms.
Okay. So anything that feels off, you should probably get
yeah,
it
especially in your chest, anything that feels off, or on your shoulders, or from here down, you got to be careful.
Okay.
Especially in older women with risk factors.
Right. Okay. Good to know. Well, Don, thanks for joining us. And what is your question today?
Yeah, I have kind of a question or a statement. It's something that's really not talked about that often, and I wanted to get his opinion, and maybe they can address this either today or sometime when they have conversations to perhaps save a young life. But I got to get a little knowledge here. The condition where youngsters have when they're going into puberty, and the nerve pathways in their heart are like shorted or connected to one chamber to the other. Is that called Wolff-Parkinson?
Yeah, that's more like, you know, you're born with those abnormal connections between different chambers, and most of the time it's very benign. They'll have some palpitations where the heart starts racing and stuff. Very, very, very rarely it can be life-threatening, where, you know, when you have more dangerous heart rhythms called atrial fibrillation. That is very uncommon in younger population. As you get older, you can have AFib. That's why when you have something like Wolff-Parkinson-White, you may want to get a procedure called ablation, where they kind of burn off those accessory pathways. Because if
and that was the last word.
Yeah, ablation.
I couldn't remember the White, Wolff-Parkinson-White.
Yeah.
And I thought, I don't know how prevalent is it in youngsters, and I'll tell you the backstory on this. My son actually had this a number of years ago, and it seems like yearly I hear of a youngster trying out for sports, which is what he had, and he ended up having the ablation, but we could have lost him, and I don't see any cardiologists talking about it. And it seems like yearly, somewhere in the United States, I hear of a youngster going out on sports, and then they have a heart attack.
Yeah,
and I'm wondering if it's attributed to this, if y'all start talking about it.
No, this one would not cause somebody dying on the field. This Wolff-Parkinson-White syndrome, as I said, in younger people is very, very benign. It usually causes what you call a supraventricular tachycardia. And they do the ablation. Even if he were to go into like high intensity sports, he would have been fine. These symptoms usually happen at rest most of the time, and they'll have palpitations. But the danger with this is, like, you know, as you get older, there is a heart condition called atrial fibrillation that goes higher risk. And when you have atrial fibrillation with this accessory pathway, that can cause dangerous cardiac arrest. So in younger population, so this is extremely safe. You know, it's not really dangerous. I would not have anticipated that your son would have had any life-threatening event with that. So I'm glad that he got it ablated, because
everything turned out. But the purpose of this call was to alert young parents to be aware of it, because we didn't know what was going on. We were a young parent, but I thought it was more common. I mean, he actually did pass out. He was doing sports. He was doing football and soccer, and because his heart started racing and he wasn't pumping properly, he did pass out. And I thought it was more common. And I hear these young deaths, and it just concerns me that, you know, maybe that conversation should be had.
Yeah, absolutely.
You know, as they're part of their physical.
Well, this Wolff-Parkinson-White can be very tricky. Sometimes it just shows up on an EKG. A lot of times it doesn't even show up. So most of the time is just you have to listen to the kids when they tell you that they have these symptoms, and then, you know, we do the monitor sometimes, and then we'll be able to catch it on the monitor when we do it. And sometimes, you know, we may never be able to catch it, and then sometimes we may see it on the EKG, and then we can see that there is an accessory pathway, and then we'll send them for ablation.
Well, my point is it normally happens at least with our experience, it happens on a sports field, and the coaches don't know what it is, and the parents don't know what it is, and he's sitting there having basically, you know, racing heart where he's no blood pressure, and he passes out. So
absolutely,
it's scary.
That's definitely extremely scary. So whenever you have something, that's what I was talking to Courtney about. Whenever you have things like that, it's absolutely imperative to talk to your doctor, go to a cardiologist, get to the bottom of it, and see what's going on. Especially passing out when they're active, it's a very bad sign. Meaning that on the track or whenever they're extremely active, that's a bad sign, and that really need to be addressed.
Right.
And I'm glad your son got it diagnosed and got it taken care of.
Good deal. Yeah, thanks, Don, for joining us. And if you're just joining us, you can talk with us live. That's 318-219-4569. It's also right there on your screen, and we'd love to hear from you. We are talking about specifically heart disease in young adult population, and if you have a specific question about that, give us a call. So we've talked a lot about, you know, lifestyle factors, and one that maybe we want to really, I guess, raise awareness of is the tobacco use and how that can maybe damage your arteries. Is that true? And is how?
Yeah, absolutely. Yeah, this has been known for a long time that tobacco is never a good thing. It's associated with a lot of stuff like cancers, you know, bladder cancer, pancreatic cancer, lung cancer, heart disease, strokes, everything. So yeah, definitely tobacco abuse plays a big role in heart attacks, especially in younger folks. And we see a lot of people who abuse smoking, tobacco abuse. They come in with heart attack at a very young age, even though they don't have any other risk factors. Sometimes people say, okay, yeah, I do, what do you call that, vaping? Yeah, the same thing too. It's actually sometimes it has worse side effects than smoking cigarettes.
And sometimes, a lot of times, you don't know what is in the vaping products,
absolutely,
and that can be scary.
So yeah, I would definitely stay away from all of those. And if you're smoking now, so just cut down on it, or not cut down, just quit.
Right.
Right.
Okay. Yeah. And so it really brings back the importance of lifestyle, changing those lifestyle factors. So what are some of those top ones? We kind of have mentioned them. But if somebody has a long ways to go, what are some top 3 things that you'd say you could focus on today?
Top 3 things I would say lifestyle changes would be good diet for sure. Less carbs. Just put in as many carbs as you're spending, because all the extra carbs that you get are going to be stored inside the body, and then that stores are the one that triglycerides and atherosclerosis that kind of builds up in your heart arteries. So put in as many carbs as you're burning. So if you're extremely active, you can have a little bit more carbs than other folks who are not very active physically, and then a lot of veggies, that's really, really important, because these days we don't get to see a lot of people who eat a lot of veggies, a lot of vegetables, fruits and vegetables, and a high protein diet to maintain a good muscle mass, cutting down on red meat like beef and pork, and white meat is okay. That's what I tell my patients all the time. Chicken, fish, turkey, egg whites are good, not the yellow, but egg whites, and dairy products are in moderation are good, because it gives a good amount of calcium and vitamin D and all the other stuff. So more plant-based diet, less red meat, high in protein, moderation of carbs. That's the diet. And then exercise, what the American Heart Association would recommend is at least 40 minutes each day, 4 days a week of at least moderate intensity exercise. You see a lot of people wanting to do 10,000 steps, which is good. But what's recommended is 7,000 steps is what you need, because if you don't, no physical activity, very high risk of heart disease, and the risk starts going down as your step count increases. At 7,000 steps, it kind of plateaus. So once you reach 7,000, you got all the benefit. Beyond 7,000, it's more like a plateau. You can do 10,000 steps, which is good. But if you want to do more to improve your endurance and muscle mass, which is good, I would recommend, if you can do it, just do it. But try to at least get 7,000 steps every day.
Yeah, that's good
if you're
advice.
not into doing the steps, swimming or any kind of cardio and weight combination, just do some cardio, do some weights, or if you don't enjoy doing weights, you can just do cardio. If you don't enjoy doing cardio, just do weights, whatever. Just maintain some physical activity, at least 40 minutes each day, 4 days a week. Just moderate intensity. You don't have to really push yourself through it. Just do what you enjoy. Once you're tired a little bit, you can quit, but just keep doing it every day. Those diet, exercise, and avoid alcohol. Well, alcohol, basically leave it only for occasions,
Right.
More recent studies have shown the safe amount of alcohol to the body is 0. So no alcohol is probably the best. But if you enjoy alcohol, just limit to occasions. Don't make those occasions frequent. Just occasional, when you're with friends, just have a couple of drinks and then be done.
Limiting that exposure.
Exactly.
Sure,
so limit tobacco abuse, any kind of drug abuse, quit the tobacco abuse, and just limiting alcohol consumption to a bare minimum. And I think those are the top 3, I would say.
Awesome. Yeah, I think, and I'm sure there are many more, but those are really important.
Right. Those are important. Once you start this, and then definitely the risk of heart disease will be cut in extremely low. Even though you have a strong family history, even if you have a strong family history doing these, I've seen a lot of patients who live their full life, without even a
And I think one thing people don't maybe realize is that you don't have to be perfect. It doesn't have to be perfect all the time, just that consistency.
Exactly, right. So you don't have to be if you missed 1 week because of some issues, just go on the next week. It doesn't have to be perfect, you know. Just again, one more thing I want to stress is the mental stress, you know, just have adequate sleep. You know, I see people stressing out at the job, work stress, you know, that's kind of very prevalent these days, you know, that should be cut. Meaning that it's easy to say, don't feel stressed out, but you need to try some relaxation techniques, maybe meditation, yoga or something. Try not to stress out. Have enough sleep, at least 7 or 8 hours of sleep every night or day if you're working nights. You know?
And that kind of goes to, you know, if you are having poor sleep. My dad has sleep apnea, and
absolutely.
you know that was a big factor for he just felt crummy all the time, and you know, he realized, oh, I do have this really scary diagnosis that could potentially be, you know, impacting my sleep. So is that something that somebody should get addressed if they're not getting good sleep?
Absolutely, yes. If they're not getting enough sleep, one thing would be, you know, sleep apnea is one thing. Sometimes other psychiatric conditions like, you know, depression, anxiety could be contributing to it. If you're going through that, get help with your family medicine doctor and talk to him or her about what you're going through, and if there is some medication that can help you out with depression, anxiety, go on it. And if you have sleep apnea, use get a sleep study and go on a CPAP, because lack of sleep can raise the stress hormone levels in your body. That raises your blood pressure, and then once your blood pressure goes up, and then your risk of heart attack goes up. You know, all those things happen, and they're all like a vicious cycle. So mental health is extremely important, which kind of, you know, is not good lately, you know, with all the younger folks. Mental health, good diet, exercise, and sleep, they're really, really important.
Yeah, all these things, and to prevent to see you in an emergency situation. You know, we don't want to
I don't want to see
there.
anybody in an emergency situation, but yes, that's what, you know, folks need to do to cut their risk, and then those things really work.
Awesome. Yes. Okay. So what about, we just have a couple of minutes left. So what about, you know, we talked about genetics, but what about cultural backgrounds, you know, ethnicity, and how that can affect your risk?
So that does impact some, especially African Americans. They tend to retain more salt. So definitely a salt restriction is extremely important in African Americans, because they tend to be more hypertensive because of their salt retention. And they need to check the blood pressure and treat it accordingly. And then the Native Americans especially have high incidence of diabetes and obesity that can cause heart disease in those folks. And also poor socioeconomic status, you know, their issue would be lack of access to health care and green spaces for regular exercise. So they need to just put an effort to just get to a doctor to start all the screening processes, and then maintain a good active lifestyle. And access to healthy food is also important in those folks.
Right. And one thing that I just thought of is some people may be thinking, well, I could do all these things, change all these lifestyle things, and then what if heart disease still finds me? Does that, you know, that still is a factor that, you know, you could still have heart disease or heart attack, but does it really maybe impact your outcomes when you have a healthy lifestyle?
Absolutely, yes. If you have a healthy lifestyle, you know, the kind of blockages we see when we do the angiogram on these folks is not as bad as people who did not take care of themselves, and they definitely have good outcomes, even if you have an event. So the outcome definitely is much better in folks who have a healthy lifestyle. So so just do your part. Don't stress about what's going to happen, and just do your part, and just take whatever comes your way. And most of the time, it works out good.
And you know, if it does, God forbid, in the event that it does happen, you know, there's people like you in our area that can help.
We can help.
So if somebody is interested in maybe getting established in, you know, getting checked out with Willis Knight Cardiology, where can we find you, and how can they get in touch with you?
Yeah. So if you need a visit to a doctor's office, cardiologist's office, you know, you can reach my office. It's the phone number is 318-631-6400, and you can make an appointment, and you're always welcome, and we'll get you a timely appointment and see you on time and take care of you.
All right, yes, and that's right there on your screen as well, all the information and where you're located, which is on Hearn Avenue. That's
Hearn
Willis Knighton
Avenue, yes.
North.
Willis Knighton North, yes.
Okay, good deal. Well, this has been very insightful. Hopefully you learned a lot about how to prevent heart disease and just, have these best outcomes. And a lot of it boils down to, as you said, diet, exercise, preventing or, limiting alcohol and tobacco consumption as well. So,
and good
sleep
mental
and
health, sleep and relaxation techniques.
all the things we've heard time and time again, but sometimes it's good to hear it again.
Exactly. So you got to just drum it up a little bit sometimes.
All right. Well, thanks, Dr. Beedupalli, for joining us.
Thank you, Courtney, for having me.
Absolutely. This will be
pleasure.
on our website, ktbs.com/podcast.